whatever.
I can keep an eye on the chat box. If that's helpful.
Yeah.
We'll get started here in a few. We'd like to thank you all for joining us. We'll give everybody a few seconds to get settled in, and we'll get things started.
Ouch.
All right, give it about another minute and we'll get going, everyone.
Changed spots from when I went upstairs to go to the bathroom. So
All right, hi everyone. Thank you for joining us for the innovative strategies related to maintaining service.
what?
Excuse me, are we having trouble? Oh, sorry about that. Again, just thanks everyone for joining us for the innovative strategies related to maintaining service, delivery, and client recruitment during COVID presentation. The speakers have elected to introduce themselves, but before that, just a few reminders. This session is recorded and will be available on the conference platform 1 hour after the session. We want to hear from you in the chat, so please feel free to ask any questions. We'll kind of keep that going and present the presenters with any questions or thoughts you may have. Also, we recommend using the conference platform chat feature because the chat will be recorded with the session. Please keep yourself muted unless asked otherwise. Without further ado, I will turn it over to our speakers.
Good afternoon. Hi, I am Sherry Doctor. I am the maternal child health, becoming a mom, and also the maternal child peer support group coordinator. I also have a bachelor's degree in nursing. And then I am certified as a lactation consultant and also a certified perinatal mental health consultant. Prior to working at the health department, I was a registered nurse for a small rural medical facility, and then also for inpatient behavioral health facility as well.
Hi, I'm Teresa Starr. I'm from Neosho County Health Department. My major's in business.
Maida's not here.
I have been here at the health department for 21 years. I started out in the MCH program where I got my start. We work very diligently with these programs where we do bridges and child health care, and we also do the MCH program, which we love.
I'm Breva Spencer. I'm the maternal and child health supervisor at the Riley County Health Department. I've been here 11 years, and I first was in the child care licensing program as a surveyor and then the supervisor, and then moved into the maternal child health supervisor position 4 years ago. I'm a licensed bachelor social worker, and prior to working at the health department, I had many social work positions within the state and KDHE and other type avenues. So
Hi, my name is Maria Garcia Vaquero. I am the maternal child health bilingual navigator. I've been working for Riley County Health Department for a little bit over 11 years. I am a certified lactation counselor, car seat technician, safe sleep instructor, and many other little things that you kind of end up doing at the health department level. I kind of worked in implementing different curriculums. That's like the March and Dime Spanish and English program. I've participated with different programs like the Breastfeeding Coalition to translate documents. And additionally to that, I work hand in hand with prenatal and postpartum moms at home visiting programs and with the other social workers within our group.
Thank you for all for that introduction. Everyone, our panel today was kind of tasked with answering 6 different questions regarding COVID. Maria, I'll just start with you since you just left or just stopped speaking. If you would tell us about you and your home visiting program, your role, and how many home visitors do you have in your program?
So I work for the maternal child health program, and we do have 2 social workers. We have 2 nurses that we work with, and we have a MCH visitor, home visitor. Within this program, we provide prenatal education, postpartum, through the age of 5. As far as my role, I kind of have different roles within the whole gamma of the program. I provide interpretation services, but I do a lot of case management within that particular program itself. I'm going to defer to Breva because she's my supervisor, so she could probably give you more details of all the people who are staffed, and she's probably more versed in that area.
So we're fortunate to have another grant that helps supplement our program here, along with our MCH funding that we get through the Aid to Local grant. So we kind of have a combination of programs working together to provide a holistic approach for our clients. And so through another grant, we're able to have 2 licensed social workers that do enrollments and kind of work with our families, prenatal and postpartum, for an extra layer of support, and do curriculum work as well. And then we also, like Maria said, we have our MCH home visitor who does prenatal and postpartum visits. We also have Becoming a Mom classes that are integrated into our MCH program. And we also have 2 nurses, one that is a maternal and infant nurse, one that's our MCH nurse. Our M&I nurse typically does prenatal appointments, and our MCH nurse usually does our postpartum and also accompanies our MCH home visitor on those visits as well. So that's kind of how our program is combined or kind of operates.
And Sherry, would you like to go next?
Sure. As I had mentioned previously, my role is the maternal child health coordinator, and then I'm also the RN and home visitor. So we do have another RN. Currently, we have that spot open, so actively searching for that. And then I have a social worker, and I have a program assistant / translator who does all of our Spanish speaking visits with me. We also have another home visitor that's also a WIC breastfeeding peer counselor. So as she's doing her WIC appointments, she's able to integrate the MCH education components into that visit as well. We do prenatal, postpartum. We're there for case management services. We refer to community resources. We also teach BAM as well. And then we are very lucky that we are able to visit our local birth unit Monday through Friday. A home visitor will be able to go up and offer a home visiting service to delivering moms in Saline County. And just recently we are acquiring McPherson County as well. So we are getting that set up in the hospital and with the OBGYN providers in there too.
All right, and finally, Ms. Teresa.
One of the things that we have is we have a specialist nurse that helps with the MCH program. We have a MCH provider that does the home visits, and we have a translator that is WIC coordinator, and also our breastfeeding peer counselor. And we're also blessed to have the IBCLC lactation consultant in our program. So that's what we have. And
All right, well, thank you, Teresa. To you all, prior to COVID, how and where were most of your home visiting services delivered?
we did ours at home. We would go into the homes, we'd make appointments and do that. We'd set up a time and get some information and then visit. And sometimes we'd take a partner with us. We did it in our WIC programs. And if they were a family planning client and they were pregnant, we found out they were pregnant, they did a pregnancy test, we give them a warm handoff to tell them about both programs.
For Saline County, prior to COVID, we were doing our visits in person. And as I had mentioned earlier, we were fortunate to have that daily Monday through Friday visitation at the birth unit at Salina Regional. And we also are fortunate as well to have home visitation with our WIC breastfeeding peer counselor, who was able to integrate those services during her WIC visits with moms. And then additionally, we had collaborated with our Parents as Teachers programs. We had offered like a dual prong approach where we were able to visit at the same time, which our parents enjoyed because, we could both be there, collaborating with the parent.
Same for us in Riley County. We were doing visits in the home. We also have a partnership with Via Christi Labor and Delivery, where our MCH nurse goes twice a week and provides services and support, and can then additionally go out to the home if requested for breastfeeding support, weight checks of baby, any of those types of things in that postpartum period as well. So
We also have a collaboration with the local OBGYN clinic. And so in that setting, we are also able to meet with some of our clients as well.
Awesome. Now, during COVID, did any of you had to change your ways you were conducting your visits and accommodating to, parents' safety and needs?
For Riley County, we definitely switched to a virtual platform and began doing virtual visits with most of our clients in the beginning of COVID. Around that same time, I believe KDHE put out a Technology for Families grant that we applied for. So we were able to receive funding to provide iPads and internet connectivity services for our families who otherwise wouldn't have been able to connect with us or continue visits, that kind of thing. So we also moved our Becoming a Mom to a virtual platform as well through Zoom, and had to tailor a lot of our paperwork and kind of how we were going to set it up to make sure people were still engaged through that process of virtual trainings as well. So our MCH clerk was very instrumental in converting a lot of our paperwork over to PDF fillers and making sure the Zoom links were sent out to our clients and things like that. So
this is Tristar, Nash County Health Department. We also got the grant for from KDHE, so we did get laptops. We did some different things. We did a book drive for some of the children, and they would sign up through WIC, and then we would send out books to them. We also did we got a bee costume, and we went out and we had window visits with the children and the bee. And one of the other things that we did the Santa and Grinch at the holiday and gave out mom bags and children's informational stuff. and of course, a few things for the children.
For Saline County, obviously it changes the way we had to think outside of the box, so to speak. So we were no longer able to visit the birth unit. We were not able to have people come to the office. We were not able to go into the home. And so with that, we were very fortunate that the birth unit would fax the consents to our office. We would then reach out to the parents through text, email, phone calls, and we did appointments whenever, wherever we could. We did porch appointments where we would stand on the sidewalk and mom would be on the porch. We did the virtual appointments where we collaborated with other community partners and included them in the Zoom calls so we could still keep that collaborative effort to help support mom what they're needing. Parking lots, we had them sit in their car. We would stand in the parking lot. We would drop binders off. We would drop education off on their porches. We did whatever it took. I can't say enough. My staff, they were rock stars.
Awesome. That's good to hear. And I guess along those same lines, did any of you, I know a few of you have touched a bit on it already, but how did recruiting change, or did you have to change your recruiting efforts?
I know for us, we did. One of the big things, obviously, when COVID started is a lot of our collaborative partners stopped services. And when I say stopped services, they went just a bare bones crew. They might have been working from their homes. And so what we did was reach out to those partners, do a survey on what they were doing, what they were still providing, how they were providing it, how we could collaborate with them, what their delivery service mode was. So another thing we did as far as we had virtual baby showers, virtual BAM classes, virtual community meetings with our collaborative partners again, and then just the phone, the text, email, social media. We reached out to community groups through social media where we know a lot of moms are participants in, and just putting up, we are still doing home visiting, check us out, we can make it work, whatever it takes, because we were seeing such an increase with our mental health concerns and increase of moms that, after we provided the education, they just wanted to talk. They were lonely, they had been isolated and things like that. So yeah, it took a village to make it work, definitely.
Here at Riley County, one of the benefits I see from having to switch to a lot of the virtual was that we were able to expand our services to a population that sometimes we were unable to reach due to language barrier, due to transportation issues. All those barriers were kind of removed with the virtual platform. And so because we focused so much on that virtual platform, we were able to expand and reach places that originally we kind of were not really thinking about because we were just so busy with the day-to-day activities. And so social media definitely was an area that we were able to target and reach out and provide information specifically for the Spanish-speaking population. They weren't getting much news about anything through any media. There was no outlet to get their information in Spanish. And so that social media for me became a very strong way to communicate what was just going on in the community, just the simple things about where to get testing or where to get services, or overall just to get information. And so for us, at least at Riley County, I feel like it was a great opportunity to expand what we were already doing so well, but to a population that we were not able to reach at some point. So we were able to do hospital tours. We did virtual hospital tours, which kind of sounds funny, but it was a great way just to introduce the hospital to people who probably never made it to the hospital before, and just educate them in some of those basic things that we sometimes don't even think about that is so important, like getting to the hospital for your laboring. And so I think it gave us a great opportunity to expand our service to a population that we were kind of missing.
Additionally, I think our partners who were kind of overwhelmed, such as our OB and our labor and delivery unit, were really searching out other options and places to send people for assistance on breastfeeding and the services that we provide, where before it was kind of, they could handle it or they would triage those kinds of things. I think with COVID, everyone was so overwhelmed and overworked and whatnot that they were actually wanted to connect and make referrals to our program to better serve the clients. And then we also tailored a mental health piece around that as well. And we were able to partner with the K-State Family Center to have student therapists on site to provide PMAD or any type of therapy services that any of our clients might want to receive during that time. So that was also very important and probably something that we may have got to at some point, but definitely COVID helped push that along as well.
One of Neosho County did was we partnered with the Pregnancy Resource Center. And so if there was a need that a mom had or to meet a mom, we would gather information, or if they needed diapers or clothing, we would get those sizes. If they couldn't get out, and we would take them to them. And that's why there was no contact between them and the Pregnancy Resource Center if they didn't need it. We did home phone visits. We did Zoom for our IBCLC and our WIC. We did a number of different things to change the way we introduced ourselves and met people. We started parenting classes, and we started those over the Zoom, and had a great curriculum for that. One of the other things is we tried to advertise that we are here. We Facebooked, we put it on a billboard in our town. We built a website and a Facebook site, a Facebook site just for MCH and breastfeeding.
That's great news. I'm going to kind of combine these last two questions, and I think you guys have really touched up on this already, but are there any other innovative strategies that you've implemented into your daily work, and or what strategies have you kept using even after, I guess, the initial COVID rush, we would say?
This is Teresa Starr, and I'm going to say I have this absolutely amazing MCH group, and she is extremely creative. Her name is Stacy Wright. We love her. She implemented Prince and Princess parties. We did a breakfast with the little children came all dressed up. We served cupcakes. They recently just did a family resource fair, which they had my family there, Pregnancy Resource Center, and several other openings that she had. And she ordered the Prince, Princess, and the frog outfits, and everybody was dressed up. She just did Touch a Truck, where you went out and you got to see a fireman, a policeman car, a sheriff car, a caterpillar. I know that's not what it is, but anyway, a big thing that digs holes, and just different things like that to engage these children and the parents. The other thing we did, we contributed to a library where we encouraged reading, and so if they read a certain amount of books, we donated books to that family. So that was like a book, read, and then drive, and then we did an exercise and read drive.
Riley County, we've actually, with COVID, there was a lot of grant funding that came out of that. And so we've tapped into some of those grant resources and been able to provide incentives for most of our clients around most of our services. So becoming a mom, we have gifts that you receive through going through the Becoming a Mom classes, our prenatal clients receive little bundles along the way with things that they can take with them to the hospital. Postpartum, they receive a gift card for coming to their 1, 3, and 5 postpartum nurse visit and completing an ASQ, which is an ages and stages questionnaire for their infant. Additionally, we partnered with Hy-Vee to do fuel vouchers. We've done Hy-Vee meal kits that you can freeze and parents can thaw and cook whenever they need to, or if they're in a pinch or a bind. And then we try to think outside the box as far as sensory items and safety kits and things that we can provide back to families, as well as obviously fuel vouchers are huge right now, especially with the increase in gas prices and things like that. So we've tried to do some incentivizing around our program to hopefully bring in and recruit more people into our services, and also provide some of those needs that they're not able to meet.
I would say for Saline County, our virtual platform, and then also we participate in IRIS, which was fantastic. Those of you that are not familiar with IRIS, it's an integrated referral and intake system, and that is built by community collaborative partners where you can make a referral and you can refer to several different agencies at once. So when COVID hit, as I mentioned earlier, a lot of places had people working from home. They weren't near the fax machine to get the referrals. So we were concerned about that, because we had mental health referrals, we had DVAC referrals, we had, shelter referrals and things like that. And so having that IRIS system was a huge support being for our COVID time. And then with the visits, we were able to, take our time and see what was going to work for the parents. We made weekend visits, evening visits, just whatever is going to work for them. So we've done the virtual visits where we have dad in one location and mom in another location. So that has been a benefit because dad's able to join in on that visit. So, but we have kept the Zoom visits. I know there are, we've offered the in-home as well. And, ultimately we like to see them take the in-home visit, but we still have several parents out there that are not comfortable with that yet. So we do continue with the virtual. And we've had a wonderful success story that, we've had some people ask, how well do you think they're retaining the education? Well, I want to share a success story if I can. We had a mother that actually attended all of her becoming mom classes virtually. And she went to see her provider 2 days before she was going to be induced, and she had noticed a decrease in her baby's fetal movements. And long story short, Count the Kicks education that we provided virtually, she was able to apply that and knew that there was a change with baby's fetal movements, and they did an emergency C-section, and baby did have cord wrapped around the neck 4 times. So she said, and it's just amazing how much, if we didn't have that virtual option, she would have not had those classes. So, I think it's important to have all of those different platforms available to serve who we can and when we can.
Awesome. Great. Thank you all. We're kind of moving pretty steady here, kind of fast. We don't have any more questions. Well, I don't have any more questions for the panel. Does anybody else have any questions for our speakers today? If you do, great. If you don't, that's fine too. If not, I guess you guys can possibly come unmute, share some of your success stories and or some of your kind of innovative strategies that you have, implemented within your agency. That would be great.
I'll ask a question and maybe others will think of some things. I was just curious, and this is for any of the panelists. From your observation, do you think the incentives help with engaging people and keeping them coming back or breaking down some of those barriers they have to attending meetings or visits?
I have seen it work both ways in Saline County. Obviously, we are able to provide some really nice incentives for becoming a mom classes. And then with our MCH program, we provide, sleep sacks and things, books and things like that. But, I've seen it. People have commented more than once. They will say, I just came for the education, or I just want the education, and have declined in order to be able to give that incentive to someone that is in more greater need than they are at that time. So
I think for us, the word of mouth gets out a little bit more when you incentivize the services. So we've had clients say, well, I went to my friend's house and she said that, if I did your services, potentially I could get a pack and play, or this and that type of thing. So I agree, it kind of goes both ways. However, I do think for word of mouth and getting our program name out there, it is beneficial. I think it's hard sometimes to navigate what is useful and beneficial versus not. So that's why we try to think out of the box with the fuel vouchers and kind of the meal kits and that type of thing. A gift card's great, but you're not always sure what it's going toward, or that kind of thing. So I think as we implement incentives, we're going to try to be more creative and think outside the box and really hone in on what our clients' needs are, which is kind of how we came about with the fuel vouchers. So I agree. I think it can kind of go both ways, but I also think these are clients that usually need our services. And if we can provide education and incentivize, it's kind of a win-win for them as well.
One of the things that we did in Neosho County is we engaged the children first, which brought the parents in. When we did the Princess and Prince party, the little people came all dressed up. They had their best on because they'd been cooped up for a year. The parents stayed, they enjoyed it. Everybody we had muffins, and we found out engaging them drew in the parents and drew in different information and education. And then that's how some of them that were not even a client of ours became a client, because they saw what we were doing, because they came take their little people there, and it really worked well. And so we did a pizza Prince and Prince party, and now we're doing a Get the Scoop in a couple of weeks, which is an ice cream party.
Great, thank you all for sharing. We do have a question in the comments from Miss Kim. She asked, what are you doing now as we are coming out of COVID to build back up your clientele in regard to recruitment?
We're advertising. We are building up our website. We're on Facebook, and also we're doing an electronic billboard and talking about our services and our programs. Again, we partnered with My Family, Parents as Teachers, DCF, so many other partners to find out who we need to help, how we need to help them, and what we're missing, and what we can do better to help these parents. But that's how we're engaging them and getting them in.
for Saline County, we are actually accepting more now that we can in person, more speaking engagements. I know I will be speaking at a women's homeless shelter coming up. And then I had mentioned earlier, be meeting with some county OBGYNs and hospitals. We just had a meeting yesterday with Salina Regional. They have a new director there. So, and then also during that meeting, we have been asked to have our home visitors come to staff meetings and introduce themselves and let the parents know, what we're there offering. So I have joined mothers groups. I've been asked to speak at different mothers groups, which has been really great. Um, I had a story just recently in the paper with a huge article about maternal child health home visiting and our becoming a mom classes, which we want to show the benefit, the value of these programs. And I think that's the best way of getting it out in the community is the advertising and doing those things.
Yeah, Riley County also received some grant funding to do some additional advertising in the community. So we actually did a commercial spot on our local radio station. We also are doing Cox Media streaming services commercials with a little video as well. So that's exciting. We're waiting to hear back if that's been fruitful and can see kind of what our demographics are and who's been clicking on our links to our services. Additionally, during COVID, we were able to partner with our local OBGYN, and they are sending us fax directly for client referrals now, where before it was very minimal. So we're receiving most everyone that comes through their door, we receive a referral for now, and then are able to contact them to try to set up services. We were back in the hospital within a year, probably, or a year and some change, doing rounds at Via Christi again. So that was also helpful and kind of supported the nursing staff on the labor and delivery unit as well with anything that would happen outside of after they were discharged. And then I think additionally, just trying to encourage our clients to tell others about us, and especially with the Spanish speaking population, which Maria can speak to, once they feel safe and feel like you're a great resource to them, the word spreads like wildfire. And so that's kind of the reason for creating the bilingual navigator position was, from just all of the word of mouth and the extra and additional services that we were trying to provide to the Spanish speaking population in our community. So I'll let Maria speak to that a little bit more.
Yes, so for me, I had been working with the Spanish speaking population for quite a while. So people knew of the services that we provided, but I think what assisted was being able to really communicate with our partners in the community and finding out what was the gap, what were they needing, and becoming versed in those areas. Sometimes community partners are kind of limited. And so taking it among ourselves here at the health department, seeing where was the need, how can we get trained so we can kind of hit some of those target areas. And then additionally, how can we support our community partners so we can get those referrals. The Spanish speaking population was a very difficult population to reach just because of the lack of communication that gets out in their language. And sometimes things do get lost in the translation of things. For me, being able to use this platform, this virtual platform, was amazing. And it did in so many ways what I could not do, like in one session of becoming a mom. And in a class setting, I could probably interpret for 1, 2, 3 people at the most, but in a virtual platform, I could have a full room of people and I could reach a lot further. And so for me, I know that a lot of people I hear that overdone with Zoom, but for me, Zoom was that moment that I saw, wow, I could really impact so many other lives, which eventually they'll get to other people and educate. And I'm going to just a short story. I have a client that she loves becoming a mom. She talks about our program constantly. She loves our program, and she has been probably the best marketing key that I've ever had beyond, the marketing money that we use for advertisement, because people do take their peers' words. Like if they've lived something, they've gone through something, and they can say something positive, then that's amazing. So I say building those relationships, communicating with those partners and finding out where's their need. And if you can fill that need, sounds kind of cliche, meet that need, right? And so I think that's the most important. Find out what your community needs so you can be where they need you.
Great, those were awesome questions. Thank you all for providing your feedback. Again, I'm leaving it open for anybody who wants to share any of their experiences, innovative strategies, or if they have questions for the panel or for myself, please feel free to share or ask away.
I just want to say thank you to Maria. Hi, Maria. I'm actually a Spanish interpreter and translator. And what you just said, it explains so many things. One of the things that I also heard from Sherry was word of mouth. With the Latino community getting to trust you, listening from other people like, hey, you should call Maria. I just found this out. You could do that. You know, they're giving this cribs for moms that goes to this program. That's what gets the word out. That's what gets them to kind of trust you. And once they do, it spreads so fast. And just what you're doing, what you guys are doing is absolutely wonderful, reaching to these people that many of them don't have transportation, don't understand the language, don't speak the language, and trying to connect them with the program is something amazing. So as an interpreter, I struggle with that. I work with the Shawnee County Health Department, and we are actually, I know that my supervisor is probably listening, and she's been wanting, how can we get to these people? How can we get this community to come and work with us? We're struggling now because we're short of staff, but listening what you guys have done in your experience, it's wonderful. Thank you for sharing that. That helps a lot.
Anyone else would like to add in?
I will go ahead and express my gratitude to Riley County Health Department and connecting us with one of their home visiting clients who is a Spanish speaker. And we were able to do a video interview with her and her little baby too. And yeah, make a video, and hopefully soon we'll have it ready for others to share, and maybe that could help be a recruitment tool. And even though Gabriela won't be able to, spread that word of mouth probably beyond Riley County, hopefully she can through this video.
Thank you so much, Holly, for the opportunity. I think that the more we are able to share a story, and you put a story to what we're doing, it's very impactful. I think it guides us when we're able to share that information in a global way. And so I appreciate the opportunity to be able to share our families with you.
And then I see Stacy has a comment in the chat. Oh, that Neosho County did a resource puzzle during the resource carnival. The kids went to the resource, they played a game, they got a piece of the puzzle, and then when they put it together, they sent in a picture and got a prize. And prizes were things that kids would enjoy. And that's awesome. And that kind of ensures that they get information from everybody who is there. Don't miss anything and don't just sweep through, but really engage. And if you want to say anything about it, Teresa or Stacy, feel free to come off mute.
Terrible. I forgot to mention it. Stacy did this amazing puzzle. She put it out. She made it. She drew it. She documented it herself. And it says, Neosho County, you may be small, but you are the piece that changes it all. It's such an amazing thing that happened. And it did. The kids came, they got their little puzzle pieces, and they visited with every table. And then, of course, they had snacks. And I know she got things from Sonic, little gift cards and different things. And it was just a great event. And this went over well. And like I said, again, they're very creative. The more creative they are, the more you're going to draw people in. you know, and so that's one of the things, just thinking way outside the box.
Okay, again, one last time, does anybody else have anything else to add or ask? And if not, I believe I'll give this about 2 minutes and we can call this early, and we'll see you all tomorrow. I'd like to give a big thank you to our panelists and Holly for assisting being a moderator.
Thanks for having us.
Thank you so
Thank
much.
you.
Thank you.
I'll stick around for a little bit and let people trickle in and out.
Are we good to leave or?
Yeah, I'm just
Okay.
sticking around. Yeah,
All
go
right,
for it.
great. Thank you.
Thank
Yeah.
you all so much.
You're welcome. Thank you.
All right.
Have a good.
Yeah,
Thank
too.
you. Thank you,
Thanks,
Holly.
everyone.
Bye-bye.
Welcome. Bye.
Thank you.